Next item. The Financial Times recently did a study of the United States of America and the remarkable health results that recent reports make it possible to talk about. The article is titled, "The Huge Disparities in U.S. Life Expectancy in 5 Charts," Financial Times data. They compare 1970 to 2014, 44 years of records showing what has happened to life expectancy, how long people live, and how much money is being spent, country by country, on health care. Around 1970, the situation wasn't all that different among 3 countries I'm going to pick out: Japan, the United Kingdom, and the United States. They were close to one another in terms of how much they spent on health care and what their life expectancy was. But boy, did things change from 1970 to 2014. United Kingdom and Japan, 2 highly developed, modern, industrial, wealthy countries, spend roughly $4,000 per person per year on health care, and here in the United States, we spend over $8,000, more than double what they do. We're talking about a staggering difference. Well, what about life expectancy? It is significantly lower in the United States than it is in either the UK or Japan. We're talking a matter of years. For a country that spends twice as much on medical care, to have both England ahead of us and Japan even more ahead of us on life expectancy tells you something about a health care system that isn't working. Next interesting thing from this Financial Times study. From 1980 to 2010, the life expectancy of the poorest 20% of Americans, both men and women, fell. 80% of women saw their life expectancy fall over the last 30 years. Men's life expectancy got a little better. It may well be that the movement of women out of the home into the workplace on a massive scale over those 30 years has more than a little to do with men catching up with them, in the sense that men's life expectancy got a bit better, but women's got worse. They tried to figure out why America's life expectancy was lower than that of most countries. Scientists they record, and the story, as it's written by the reporters for Financial Times, gives the answer very unambiguously: obesity. Obesity is a serious health problem. Of all the OECD countries, the United States has the greatest problem with obesity, #1 out of all those countries. More than Mexico, Hungary, Canada, Britain, Germany, Ireland, you name it. I thought you might be interested in the comparison with France, a country famous for its rich food. The United States has nearly 4 in 10 Americans listed as obese. Using the same standard, the French have less than 2. In other words, the French obesity problem is less than half what it is in the United States, and that contributes. Well, then poverty, which goes with obesity, suggests the capitalism that produces the inequality also generates the obesity, which together with the inequality kills people before their time. It's a serious problem, and the system is the problem behind these numbers.